So one of the really nice things that we've worked on is that we've actually developed and polished the entire flow from the beginning. So from setting up your online schedule, we've actually implemented a specific teledentistry consent form on the online consultations. We have actually added the COVID-19 symptoms into the medical questionnaire, and we have a couple of extra small things here and there that we'll be covering together. So we're hopefully going to be showing you the entire thing from start to end, how to set it up, how to customize the software in a way that will actually support you better and will be able to be as flexible as you need it to be for your practice. We'll be covering some of the things that both the ADA and the CDA associations have actually sent out to the offices, which codes to use, how to build them properly. So we'll be covering all of those tricks and tips. And hopefully by the end of it, I'll go over some of the, I guess, kind of a checklist or some tips that would be really nice to kind of keep in mind while you're setting up your teledentistry, so that you know what to expect, how to prepare for it. So we'll have a whole thing, like a whole list of things to cover today. And by the end of it, hopefully what we'll be doing is whoever actually needs some additional resources will be more than happy as well to provide you with some. So we're gonna take you through the entire flow together. So as you see on your screens right now, we'll be configuring the online schedule availabilities, the details of the provider, how long you want that appointment to be. So we'll be covering all of that. We'll be able to customize your confirmation email. So what email the patient gets, how to add the link to your online, to the video call basically. So how you decide to actually go ahead and do those video calls with your patients, how to create your own progress note checklist. I'll show you what we have already set up on our end, and we can definitely help you with providing a copy of that. I'll go over the COVID consent forms that we've added onto the systems, which if actually each and every one of you goes into their actual accounts now, you'll find a COVID consent form already added into your system. So it's already there, it's available for you. You can actually edit it. You can have the patients actually sign them if they actually had to come in for an emergency visit to the office. So we'll cover all of those. As I mentioned earlier as well, we'll be going over the correct use of the ADA and the CDA codes. So which codes are actually being used for teledentistry, how to build them properly for both Canada and the States. So we'll cover all of that. And then I'll show you how to bill your patients prior to their visits. So we'll show you how to add those codes in. And if you are using OpenEdge, then that will be really a very simple online transaction for patients. So you'll be able to send that electronically through MyChart, and patients will be able to pay directly into Oryx if you're using OpenEdge. So OpenEdge, again, is the credit card processing merchant that we integrate with. Or if you have any other third-party application like Square, you can definitely set that up on the side and you can have payments processed on the side. So we'll cover that together. And then hopefully any additional configurations that are required, we'll definitely go over them together. So we're gonna start from the very beginning actually. So first things are really very simple. I'm just gonna start sharing my screen with you, my other screen actually. So I'm gonna start with the very beginning, so where you actually start setting up your online schedule. So the online schedule and the teledentistry are basically the same setup. So teledentistry is going to be part of your online scheduling. And that means that what we're going to cover right now is going to be setting up your online schedule, and then I'll show you how you can specify what is for specific teledentistry and what is not. So first and foremost, actually, I'm going to do this. So we're going to go into our admin. So the first thing you're going to have to do is actually turn that online schedule button on. And that's actually under your practice information. So if you go into your practice setup, practice information, there is a field that says online schedule, and you have to check that on. So this kind of allows you to start configuring your account for online scheduling. So that's the first thing that you need to make sure that you always have checked on. So the next thing, you go into your office hours and you can set up what kind of online scheduling hours you want. So you can have, and these are really useful, obviously, for your online schedule in general. So hopefully once things go back to normal and you want to actually turn on your online schedule so that patients can actually take their appointments using MyChart, or basically online, then this would be a list of all the types of appointments that are available. So in my case, I'm actually going to uncheck all of them and just leave my online consultation on. So that what this will do is to actually hide all the other availabilities. So for offices that have already set up some of their online schedule settings, then you don't want probably patients to start scheduling in cleanings and treatments. So you'd want to make sure that you uncheck all of them and you just leave that online consult turned on. So that's the second part, to ensure that you have everything set up for you to actually start adding in your providers. So the third step would be actually going into your providers. And I have multiple providers in my practice. So it could be that you have only one dentist and multiple hygienists. It might be that you have multiple associates, and it really depends on how you want to set that up. So if you have only one dentist in the office that will be doing those consults, then you probably don't need more than one provider to be set up online. If you have multiple associates and they all want to be providing online consultation or virtual consultation to your patients, and you want to have more than one provider available on the schedule, then you can definitely add more than one doctor. So I'm gonna go into Ronald here. I'm gonna click on Edit Provider. And you can see here next to the provider is something called Online Provider. And this will allow you to actually set up the details about this online provider. So you can either set it up in a way that every single provider is actually like an individual. So you actually have the first name, last name, or actually the name of the actual doctor. Other offices, what they're actually opting to do is naming the doctor with the name of the practice itself. So that way it doesn't show which provider is actually going to be doing those consults. And it depends on who's going to be doing them or how you want to set them up. It really depends on basically why or how you want your online consults to work. So in my case, obviously it's going to default to the first name, last name of my provider. I can add a specialty if I want, so that it shows on the online schedule for the specific provider. You can add description, so you can give a bit of a background story or background history of the provider. And this obviously is particularly useful for new patients. So if you want patients to be, new patients to be actually scheduling for emergencies, for limited consults, then that would definitely be a good place to add a small bio, I guess, about either the office or the actual doctor himself. So it kind of gives a nice description of who that person is. So you can upload a photo of the doctor. So if you want the patient to actually know what the doctor looks like, and I think it would be really nice for patients to have a face to associate that consultation for, especially that a lot of those, especially if you're going to open it up for new patients, then you really want to make sure that at least they have a face to the name. And I think it would be really nice for them to know what the doctor looks like. What some offices do, especially if you are going to be setting up the provider as the office name, then some offices actually, they just upload the logo of the office instead of actually a picture of the provider. So it's up to you really if you want to upload a specific face photo, or it could be again just the logo of your office. So you can see here that all of these are already deactivated for me, because these are the ones I turned off from my office hours. And you can see my online consult is defaulted to 30 minutes. And this can be customized, obviously, in whichever way you want. So some offices are putting 15 minutes for an online consultation. Other offices are actually giving themselves an extra 15 minutes in between patients. So what you would do is you can actually keep it to 30, but obviously limit yourself to 15 minutes with the patient, and that would give you a bit of time to spare in between patients. So that's one way to do it. So you can go ahead and say something in here like, I don't know, Dr. Ronalds has been practicing, I don't know, for 10 plus years in Seattle, and then basically, let's say, I don't know, has graduated from the Christ Center in 20, I don't know, let's say 5, and so on and so forth. So a nice bio in here would be nice. 30 minutes in here. Again, you make sure that the online schedule is enabled for this provider. Again, if you want to upload any picture, you can do it from here, and you just hit that save button. So now you basically have a provider set up for your online schedule. So all the providers that are already on Oryx are not going to show up on the online schedule. So the only ones that are going to be show up on the online schedule as available dentists to obviously take an appointment with, then they're going to be only the ones that you set up as online providers. So again, you can have limitless amount of providers on the online schedule, and you'll see how that will show up on the actual online schedule for the patient view. And some offices, again, like to have one provider only. Other offices, again, if you have multiple associates, then it would be nice to have multiple providers set for the online schedule. So we did cover the provider, the online provider. So the last step before actually being able to schedule something is to actually set up an operatory or specific times in an already existing operatory for online scheduling. So you can either use an op that is already available, so you don't have to actually add an extra column, or you can actually add an extra column saying that would say, I don't know, virtual, let's say chair. And some offices actually are doing that. So we're gonna go ahead and add an operatory, say virtual chair, status is active, and I'm gonna say order just one. Scheduling times, you can set up the doctor in here. So I'm gonna actually select Dr. Ronald from here. So that way every single appointment in that schedule will take up Dr. Ronald as a provider. Save that. And the most important part about this operatory setup is making sure that the online scheduling times are set up. And what really this helps you with is that instead of having to open up the entire day or the entire week for online appointments, you can actually specify the range of time that you want the patients to be able to actually book those appointments. So I'm going to go ahead and say this is going to be, again, 30-minute slots. Provider is going to be Ronald. And here you can actually set up multiple slots. So I can say, for example, I want my doctor to be available from 8 to 11 a.m. and then add another slot and say I want him to be available starting from, let's say, 1 p.m. till 5 p.m. So that creates 2 slots for me on Mondays, Tuesdays, Wednesdays, and Thursdays. And I don't want, for example, my provider to do any online appointments on Fridays. So it's just Monday through Thursday, 8 to 11 as the first slot. And then there is a couple of hours break, and then it goes from 1 to 5 p.m. And then you can click on add slot, and you can see that he's been added, Dr. Ronald has been added to all the 4 days, twice a day per slot. So this will allow the patients, again, to schedule starting from 8 to 11 and then from 1 to 5. So now that you have all of this set, you just go to save. And now you actually have an additional op called virtual chair that you can actually use to allow your patients to book online. So actually one thing that I'm gonna do is I'm gonna add a background color just so it's easier for me to tell what this is. I'm just gonna call it, let's see, I don't know, Teledentistry. Save. So now, oops, I only added on Monday. I'm gonna do that again on Tuesdays through Thursdays. I'm gonna say Teledentistry. So my virtual chair is in here. So if we go into the schedule right now, we're gonna see an extra chair that will be in here that says teledentistry all throughout. I'm gonna have an extra 5 columns or 6 columns that I'm actually not going to be using unless for emergencies. So what you can do actually to help yourself with just minimizing the amount of empty columns that you're not gonna be using probably just at least for a couple of weeks, you can actually go into the admin, again, into the operatory setup, and you can actually filter those out. So you can come in here. So for example, I already have a filter on Monday. I'm going to actually update it. I'm going to say, I want to show only my virtual chair and the emergency chair for Mondays. And the same is going to actually apply for every single day. So let's say Tuesday is going to be emergency and virtual. Let's say Wednesday is going to be emergency and virtual. Then we have Thursday is going to be emergency and virtual. And actually Fridays, Fridays actually are not going to be any online consultation. So actually I can click here and can say, Fridays, I only want to see my emergency column on my schedule. So that way, actually, if we go into the schedule now, it will only show you 2 columns on a daily basis, except when you go to Friday, it will only show you actually 1 column on that day. So that way you don't actually have to have more than 1 column that you're not actually using. So that way you don't have to actually cluster that view, and to allow you to actually see a bit more information and actually schedule a bit more, I guess, bigger appointments on your screen. So that will actually cover everything that you need to customize on your, again, on your admin. So I'm just gonna go over this one more time very briefly. So first thing would be under the practice information, you click the yes on the online schedule. Then you go to your office hours. You make sure that it's been enabled and you select what type of appointments you need. And again, for teledentistry, you'd want to keep the online consult on. You'd probably want to turn off the rest, again, because probably right now you're not going to be seeing anyone except if you first triage them through the online consultation anyway. And then you go into your providers list. You set up either 1 or multiple providers as your online provider. And again, you just go in here under online provider. You can set up what type of appointments this provider is going to be seeing, if he's a specialist or not, or he has any kind of bio that you'd like to add in there. Again, you can either set it up as the practice and for practice name, so the patients won't see the name of the doctor himself, or you can actually set it up by provider name, and you can add a picture as well associated with that provider. Once you set that up, you can go into your operatory setup. You can add a new op if you need to, or you can use an already existing one. You go into online scheduling times, and you can add the time slots that you want your doctor to be able to accept or take appointments. So whatever you open under the online schedule times is what the patient will be able to see on their side. Obviously, one thing that's really good to know is that any kind of blocks that are on your schedule will automatically block off your online schedule. So that's something that will happen on its own. And then as well, any already existing appointments in that column automatically will block off that online schedule. So you don't have to worry about synchronizing the online schedule with your actual schedule. It will automatically block off the times when they're not available. Another thing, once you actually do get to hopefully working off of out of your practices, again, out of the office, it's good to know that any provider that's set up to be an online provider will the system automatically check if he's available or if he's actually busy in another column. So if, let's say, Dr. Ronald's been assigned to another appointment in another column at the same time, it automatically blocks off that slot from the online schedule, because it knows that it's the same provider doing both appointments, so it automatically blocks it off. So, and that's one thing that's really important to know, that when you're actually obviously booking your appointments on the schedule, just make sure that you always select the correct provider on the appointments that you're actually adding. So that would actually bring us to the end of the setup. So you don't actually have anything else to set up, and obviously you do it once only. You don't have to change anything at any point anymore. So your online schedule is ready. We have only turned on the telecommunication for now, or basically the online consultation. And we've added an extra virtual chair into our columns. We've added some filters so that we hide everything else that we're not using. So that way we're ready to actually start with the actual customization of some of our forms. So we're going to take a 2-minute break only, and we'll be back to customizing the rest of your accounts. All right, so looking through some of the questions that came in, someone asked, how do you block the time slots on the other ops? I work from multiple rooms. So you don't have to block any of the slots that are on the other operatories, because you already specified on which operatory you want your online schedule to work off of. So again, in my case, only the virtual chair has online times. So this is the only time when actually I'll be able, the patients actually will be able to schedule appointments. So you don't actually have to block anything else at all. Unless you open yourself the online scheduling on all the ops. Otherwise, the patient will only have the ability to schedule in that operatory that you have set up as the online scheduling times. Once the appointment is in that slot, it will automatically basically flag the provider as busy. So he won't, like, you will, the patients won't be able to schedule another appointment in the same spot for the same provider, basically. So you don't actually have to block any time slots at all. The other question came in, how little in advance can patients schedule an appointment? Can it be at 7:55 and a patient signs up for the 8 a.m. spot? Right now, actually, there is no limitation to how little in advance the patient can actually schedule their appointment, which is actually a great suggestion. I think we should definitely add that as the second phase of enhancements. I think our support team can actually write that down as a really great suggestion that we should definitely implement very soon. Can the widget be used in the practice Facebook page too? I'll show you how it works. It's going to be a link. And once the user or the patient clicks on the link, it will take them to the online widget. So I'll show you how that works in a second. So it's just simply a link that you can shorten if you want, and I'll show you how to do that as well. You can shorten the link and add it on your Facebook page. You can add it onto your Insta page. You can even obviously embed it into your website. So I'll show you how that will work, and you can decide on where you want to use that link from. So we're gonna go ahead with some other customizations that are available for you. So we've done with the setting up. So now, technically right now, the online schedule would be working, but I'm gonna show you a couple of things that you can customize to get everything running perfectly for your office. So we've added, and you'll see that there are a few things that are completely new. So so they weren't there actually until today. We actually released them specifically for this webinar and for the offices to actually start utilizing teledentistry ASAP. So one of the first things that we've added, if you go under patient communication, there's the patient communication templates. And if you actually look at what we have in here, is going to be a list of all the communications that the system sends out to patients, and you'll be able to customize them yourself. So under the accept online appointments email, this would be what the system will be using to send the patient an email to confirm their appointment. And you'll see that in the flow of the work, but basically the system will not confirm the appointment on the schedule until you actually click manually accept appointment. So the patient will only receive a confirmation email that they are already set up and the doctor will be waiting for them when you actually accept it yourself. And obviously, again, we'll go over the flow. So one of the things that you can customize is actually the actual email the patients will get. And the first thing that would be really nice to add, obviously, would be the link. So you actually click on add new paragraph in here, and you can add a message saying, please use the below link on the let's say, day of your appointment to join the virtual video consultation call. And let's say I'm gonna go in and say zoom.com/whatever the code is going to be. So one thing that's really nice about this is that, first of all, you don't have to worry about the paragraph 2 and 3. So the one that says for and with, it will automatically drop in the time and date of the appointment, and it will drop in the name of the actual provider. So those are going to be pre-populated, so don't worry about them at all. The first paragraph you can change, and you can add a small intro. And one of the things that are really great about this is we've been actually obviously trying to stay up to date with all the American and the Canadian Dental Association requirements, their tips and their recommendations, I guess, for teledentistry. And one of the really nice things is both in Canada and the States, the Office of Civil Rights are actually not imposing any penalties for any HIPAA non-compliance for providers. And they actually are saying that if the providers were actually serving the patients in good faith, and especially because of those extraordinary times, they will not be basically applying or imposing any penalties on any of the doctors. However, providers are actually encouraged to notify their patients that using third-party apps like Skype, Facebook Messenger, Google Meet or Hangouts, Zoom, Apple FaceTime, any of those third-party softwares or apps are potentially basically a privacy risk. And it is good to tell the patients. And that's why we actually built in a completely preset teledentistry consent form that we'll see together once we get to the patient side. So the teledentistry consent form will actually cover all the risks of using a third-party video call. It will cover what are the risks, what are the responsibilities of the patient, and what to expect, obviously, from a consultation. So that's already built in. But another thing that, for example, the ADA has been recommending is to actually add a small note into your emails with the patients to kind of request them to do a couple of things that will help you with your consultation. So one of the actual tips that one of the ADA committees have requested or recommended is to ask the patient to actually have a flashlight on hand, for example. So that way they can actually help you with the consultation if they want to show you something, maybe somewhere in the posterior teeth, somewhere where obviously the light doesn't hit that easily. So you can actually add that into the first paragraph, or you can add an additional paragraph at the bottom saying that please make sure they have a flashlight on hand. Or as well, another recommendation has been to have a family member close by for the consultation so they can actually hold the phone or even retract the patient's cheek if they need to help you easily see some of the areas that the patient can be complaining about. So those kind of tips and tricks that, again, the dental associations have been sending out would be a great place to add them into your email confirmations. So the patient will get the link to the video consultation and a couple of requests from the doctors and the office to better prepare for their online consultation. You can add as much as you want. Again, you can add more paragraphs. You can add a whole intro to maybe some offices, and a lot of us actually are adding a small introduction to what is teledentistry, why are you opting for teledentistry in those times, how you're trying to provide patient care. So all of that would be really nice to add into the actual email. So again, you do have the online email in here. And you do have the SMS as well. So the message itself that the patient will be receiving. So again, it depends on what you want the patient to receive, but you can as well customize the message to actually include that link as well as a text message. One of the really great things that actually have been released, and we will do a small kind of announcement afterwards, but I guess you guys will hear it first. Finally, the text providers have extended the length of the text. So you're not limited anymore to the 150 characters that were previously as part of the texts that are going out of the system. So you actually have a huge limit, which is I think a few hundred, I think, characters by now. So you can actually type in a full paragraph, a full letter if you want in your texts throughout the entire system. So even when you're texting the patient, part of the two-way communication on the schedule, you can even write long text. So we've actually opened that up. So now it's completely flexible. And that obviously allows you to send as well all that information in a message if you want to. So if you want to text a patient with all that information, you can actually send it as a text. You can obviously as well shorten your links. So for example, Zoom and Skype already have very short links when you're sharing your virtual, basically, online appointments. So you can set that up, and we'll go over a couple of options together. But the link that you have from Zoom, for example, or Skype are usually very short. Like the one I added, for example, is usually like zoom.com, and then it says like dot or slash, and then there's a whole like couple of sentences in there. So so you can actually send that if you need to. Otherwise, again, you can either customize those in whichever way you want. Obviously hit the save button, because I think I didn't. So I'm just going to go ahead and say again, please use the following link to join our virtual video call on the day of your appointment. Okay, and just zoom.com again slash whatever that code is going to be, and then hit that save button. So now the patient's actually going to receive this email as soon as you confirm their appointment with the link. So moving forward to the next customization, it would be a great idea if you actually add a checklist for your progress notes specifically for teledentistry. And that's what I did on my account here, and you'll see it in a second. And if you want, we can send you a sample of it and you can actually add it yourself. So under the teledentistry, I added one called teledentistry, and I added a few items in that checklist that would make sense to probably cover as you're going through your appointment. So it's very easy to add, again, a checklist. You just come into the clinical checklist list, and then you come into the category that you think you want to add that in. You click on add checklist, you add a name. So I'm going to call it Teledentistry 2. And short name is basically what will show up on your progress notes page. So I'm just going to call it TD as part of my treatment checklist, save. So now I have my second checklist in here, add checklist, and I'm gonna say, for example, reviewed medical history, and I can say reviewed photos, and then I can say pain intensity, and I can come and say here, add a choice and say high intensity, moderate, low, and maybe add, I don't know, lingering in here. So that way I can actually add those in, and whoever is already obviously familiar with the checklist system on the progress notes, those will be checkboxes that you can check off, and those would be kind of sub checkboxes. So if I go into a patient that I have, I'm just going to go into a random patient just to show you what that's going to look like. And then again, we'll do it as part of our flow. So if I go into my treatment and I have, for example, teledentistry, so you can see here those 3 main items in here, and then I can come to pain intensity and say moderate and lingering. And then when I hit generate, that will generate my progress note. So it would be really good to it would really be good to actually have those checklists at hand, so you don't actually have to type all of this out every single time when you're talking to a patient, and actually have them pre-prepared for yourself. So it's just a button, and then if you want to add additional information, if you want to add a description of what you saw, any specific problems that might have the patient might have brought up during the conversation, then definitely it would be something that you can just click next to the actual field and then type in, I don't know, whatever, let's say patient chip tooth. So you can actually add your notes in here as well. So again, we'll go over the flow together, but this is just to show you how those checklists that you add into the list here will be available for you in the progress notes. So you can actually customize them in whichever way that you think would be good for you, and it will hopefully cover as much as possible of the questions that you'll be asking. So if you do have already a protocol for your telecommunication, if you do have already a list of questions that you always cover, or you want to always write or include in your progress notes, then definitely have them preset in those checklists, so you don't have to write every single time the same information over and over again. And it will help you just be prepared for the patient and just type in a couple of words instead of having to keep on typing every time in between appointments and kind of be super busy, basically back to back with the patients coming up. So we covered that. And one last thing that I want to show you, the customization is going to be under your consent forms here. If you actually go to your patient communication custom consent letters, you will see COVID-19 letter in there already. And these are already part of your realms. Everyone's accounts actually includes now one of those. And if you want, again, there's a bit of HTML, so you don't have to remove those. Those are just simply bullet points, and I'll show you how that would look like. So they're divided already into paragraphs for you, and already includes a patient signature. You can add, you can remove, you can add additional paragraphs. You can even add or request initials on every paragraph if you need to. But what this would actually look like, if you go into the additional documents, if you click on add from template, COVID-19, if I click on view, this is basically what it will look like. So these will be paragraphs, and this is what you were seeing earlier, the bullet points for the symptoms of the COVID-19. So, and there's a signature in here. So you can either print it out if you want to, or you can actually send it off to the iPad application. One thing that's really nice is that we're actually finalizing sending those custom consent forms to MyChart, and that will be very, very soon available on your accounts as well. So you'll be able to actually send any consent form that you want to the patient's MyChart and ask them to sign it digitally even before they come into the office. So that way you don't have to actually worry about having the patient come in and then sign it post factum. So again, the COVID-19 checklist consent form is already available. You can, as well as you can add it to the patient's chart on the iPad and have it signed digitally, or hopefully very soon we'll finalize the MyChart part of it, and you'll be able to actually send that MyChart, that consent form to MyChart, so patients can actually sign it on MyChart and then submit it to you, so you can actually see them with that consent form already signed off. So that's another thing that we've added, hopefully, to make things a bit easier, and it will definitely be available very soon on MyChart. So let's see. So we covered all of those, and what I'm going to do actually is I'm going to take a 2-minute break. I'm going to read the questions and see if there's anything pending. And we're going to start with the actual flow of the patient, so you see what it looks like as an actual flow of the patient scheduling their appointment, you getting a notification, and seeing how to actually build the patients out of the system. Okay, so a couple of things that have come in. So one thing is someone's asking if the COVID form is required to be signed for all patients, and the answer is no. You will actually only need the COVID consent form signed if the patient actually needs to come into the office. So the COVID consent form goes, if you actually read it, you'll see that it goes over like what are the risks of a patient coming into the office. He has to agree and basically verify that he has no symptoms, that he needs to use basically alcohol and hygiene to actually wash his hands regularly, and so on and so forth. So there's like the regulations, the consent that the patient has to sign in case they do have to come into the office. So that's one thing that you don't have to worry about, except again, if a patient actually needs to come into the office for an emergency. So it's not for the online consultation or the teledentistry. So that's one question. The other question as well that came in is, let me see, I think someone already answered that. And yeah, and you can basically definitely send that COVID-19 consent form by email if you want to, that's for sure. So you can just simply download it as a PDF and then just email it out if you want to. But again, it will be available like very, very soon. So we're hoping by next week it will be available. So we'll definitely update you as soon as that's out. So, but in the meantime, definitely you can send it out as a PDF. So again, if you need to customize it at any point in the admin side, you can do that. And then you can always just, once the patient sends it back to you electronically, then you can definitely always, you can always update and upload that form in here. So you can actually click on upload new document and upload that signed COVID consent into their charts. So you actually have, you can have that in their charts for future reference. Where are the records of the office emails that were sent to a patient? And actually, so Dr. Liu is asking, where are the records of the office's emails that were sent to the patient? They're all actually under the communication activity. So it's either under here. So if you go into patient communication, you will see a full list of all the emails that have been submitted to the patient. So everything that goes obviously out of Oryx, you'll see it in here. So either the automated emails and texts or emails and texts that you send yourself from within Oryx, they will all show up in the communication activity under the communication here. So you have access to it using the slider that's on the next to the patient's name, or you can access it through the patient details, or as well, you do have access to it through the schedule, which is the two bubbles here on the side. So this is how you can see all the different types of communication that have been sent to the patient. So we're gonna go ahead and start with the actual flow of the patient. So let's say you have your website and you can add a link to your virtual consultation page. So if I click on this, it will basically take me to my to a page that you have set up. You can say virtual consultation, like book your appointment, and you can embed that link that basically takes you to the online schedule through by clicking on book now. I've embedded it on my system to actually take me to my online consultation form. So again, you can actually use that link to either embed it as I did on like a button on your actual website, or you can actually use it again to, you can put it on your Facebook, Instagram page, wherever you want it to be. Again, I can show you how to shorten the link. So you can actually just add a short link to your description on, for example, the bio on the Instagram page, on your, I don't know, on your, even on your Google business page, you can actually add that link in there so patients can actually schedule. So, and this is something that will depend if you want to actually have it open for patients that are that are not your actual current patients, or for only existing patients at the practice. So in this case, it asks, like, are you a patient of this practice? Or basically, have you seen this dentist before? You say yes or no. So for example, I'm going to say yes. And then from the drop down here, you can see I only have online consultation right now available. So, and that will take me to all the availabilities that are basically under the providers that I set up. So you can see here, I have Dr. Ronald in here, general dentist, the address, the phone number, the email address of the practice. And this is the short bio that we added. So this is where it will show up. These are the time slots that are available. So you can see Fridays are closed as we set them up. So we only set up in the operatory online scheduling times that Monday through Thursday are open. So these are in here. And then you can just simply select what time you want. And when the patient actually clicks on that time slot, it will ask them to register for MyChart. So the nice thing about this is that it won't actually lose the patient's progress. So meaning that as soon as they register, it will take them to that exact slot that they already selected. So they don't have to worry about reselecting or re-looking for that slot that they've already chosen. And they can either register using their email, or they can actually click on sign in with Google, and it will allow them to sign in with an existing Google account. So they don't have to be, again, on MyChart. If they only have a Google email, so a Gmail basically, then they can actually log in through Gmail into MyChart without having to go through the registration hassle using a regular email. So if they would come in here, they would click here. So for example, I'm going to say, oops. Just going to add my email address in here. I'm just going to say at gmail.com. I'm going to click on register. And basically what the patient will receive is actually this. So actually I'm going to show you. So the patient will receive a registration email as if they're signing up to MyChart. So it says, please activate your account by completing the registration. And they would click on activate account so that they actually take it takes them to the registration form. So I'm going to show you where that's going to look like. Just going to wait for my email to refresh. So for example, so if you see my email right now, I got this right now. So I just click on activate account. And it will ask me to set up a password. So I'm just going to I might need to log out of here. Sorry. I'm refreshing my page because I think I'm logged in already in like 3 different spots. All right, so I just need to set up a strong password. Oops. So it's that. And another one, so passwords. Oops. And as soon as I'm logged in, you can see that automatically the first thing that will open up is the consent to participate in teledentistry system. And it goes over the purpose of it and what is a teledentistry consultation, what happens, what are the risks and the benefits from it, and obviously the rights of the patient, and so on and so forth. So they have to agree and proceed before actually going in. And then they can either schedule for themselves or they can schedule for another family member. So I'm just going to go ahead and say next. And you can say that, you can see here that says with Dr. Ronald on Thursday, 16th of April at 8 a.m. So it already has the time slot that I've selected previously, even before registering. So I don't have to worry about that. So I'm going to just click on next. And the patient's going to have to fill in his information. So for example, again, let's say my name is Gina Jones. And my phone number is a random number in here. Let's say United States. They add. Okay. So let's say, I don't know, Fairview Avenue and Seattle, Washington State, and zip code. The patient can actually add a note in here and they can say why they're requesting this appointment. So it could be something like, I don't know, again, chipped my tooth. It could be something like, I don't know, pain, burns. So anything that the patient has problems with. So for example, I don't know, tooth ache and burn sensation in bottom right, I don't know, side. be on. Okay, and then once they hit the book now button, and actually one thing that is really nice that we're adding soon as well is the patient will be able to submit photos to you. So in addition to a note, there'll be an extra button in here that will allow the patient to take a picture or upload a picture that they've already taken. So that way they can actually submit a photo for you, so you can actually be prepared for that appointment, so you can actually narrow down what the possibilities of that patient are, or what the possibilities of the problems can be with that patient. So then you click on book now, or the patient would click on book now, and it tells them that you're almost set. Save some time later on and help the dentist know more about you by answering some important questions. And the nice thing about this is that it actually takes them straight into my chart. So I'm going to click on do it later or continue now. So if they click on continue now, it takes them into my chart and the confidential medical forms, which I'll do in a second. Or they can click on do it later, and it tells them that your appointment request has been successfully sent and you have requested an appointment with Dr. Ronalds on Thursday, 16th of April at 8 a.m. You will receive an email as soon as the office confirms your appointment. So the patient is already aware that the appointment is not yet confirmed until you actually accept it, and they will receive an email as soon as that confirmation happens. So that way, at least the patient is not assuming that it's going to be ready or the office is going to be ready for him, except the actual until they actually receive that email. So I'm going to show you what that looks like on your side. So I'm just going to close this. And I'm going to refresh here. So on your side, first of all, you're going to receive an email that says, someone scheduled the online appointment, click here to confirm the appointment, and takes you to the login page of Oryx. So that way, first of all, obviously for HIPAA, you're never going to receive the actual name of the patient, so in your emails, but it will tell you there's a new online appointment. And once you click on the login button, it will take you basically to Oryx. So as soon as you land on the Oryx page, on the schedule, you'll see this icon at the bottom. Again, it's that schedule with a cloud on it. And when you click on it, it will give you a list of all the patients that have requested an online appointment. So this is Gina Jones that we just added. You can see here it says, for example, that the patient has a toothache and a burn sensation. So you can see the note getting transferred over. And then you can see here that it's a broken link because the patient actually is not linked to an existing patient because Gina does not actually have a MyChart account. So if the patient had already a MyChart account and they actually logged in to their existing patient, then definitely it will automatically link. Otherwise, if this is a new patient, for example, I can definitely click on create new profile, and the system will create a new Gina Jones patient. And then you can either accept or decline. So if you hit accept, the accept button, here, it will say that this appointment has been accepted. And what the patient will receive is actually the following email. So it will say that you have successfully booked an appointment on Thursday, whatever, with, for example, this is an older, obviously, email. It says with Dottie Parker, please use the following link for the meeting. And that will be the link that you add in there. So only as soon as you actually confirm that appointment, does the patient actually receive this email confirming that that appointment has been accepted by the office, and the system will send that link with that confirmation. So again, you can add an extra paragraph at the bottom explaining again what teledentistry is, any specific requests you have for them to be better prepared for the appointment. That will all go in here, and this is what the patient will receive as soon as you actually confirmed that appointment. So and this is your appointments, and I'm going to show you what that looks like, obviously, which is for tomorrow. So so a couple of things just actually to keep in mind is that your appointment, the appointment itself that you've taken or the patient has taken, will be dropped on the actual schedule, but it will be completely in blue until you actually accept it, and it actually turns into this dark color on the schedule. So that way you don't have to actually worry about the appointment itself taking up a slot. So it will actually be obvious that it's an appointment, an online appointment. So I'm going to actually show you this. I'm just going to create another appointment for us just so that you can see what that looks like. So I'm going to say, again, let's say 8:30. And if a patient already exists on MyChart, they don't have to create a new account. There is a sign in button here. And for example, I'm going to sign in using the email that I just created for myself. So I'm just going to say Gina Jones and just log in. So a patient that already has a MyChart account, they can just simply log into MyChart versus having to create obviously a new account just to schedule an appointment. Again, agree and proceed. Are you scheduling for Gina or someone else? If she is scheduling, let's say for a family member, her kids, her husband, she can always click on add someone else and it will add another family member into her chart. Or you can go ahead with Gina here. And I'm going to say just book now. I'm just going to keep it as is. And I just want to show you what that will look like on your schedule. So I missed it. Where did the screen for booking your appointment come from? So it's a link that I had embedded on a basically a mock website. So for example, if you have your own obviously website for your practice, then you can embed it as part of a button on the system. So that way, so I'm just going to show you this. So in my case, again, I have a website that was set up as a dummy website, and I have a button that says book now, and that book now button will take me to the online availabilities. So again, you can either put it on your website, you can put it on any social media that you want, or you can even send it as a blast email if you want to your patients. So you can use that link in whichever place you want. So again, it's not like an embedded widget inside the website itself. It's a link that will take you to an outside page that will guide the patient throughout the scheduling process. Let me see. So another question was, can existing patients schedule an online appointment, or is it just for new patients? No, actually, as I mentioned earlier, so if a patient, again, if you do have MyChart, I'm just going to take you through, I'll show you what the MyChart would look like. Let's see, I'll just take you through to the realm that I'm using right now. So if a patient already exists and they already are part of your practice, then I'm just gonna have to log out of here. Sorry, 1 second. If they click on login, and again, I'm just gonna go through Gina's email here. So if a patient already is available or is on MyChart, on the homepage itself, so I'm just gonna, this is gonna take me through the MyChart process. So if they do log in regularly, not using the MyChart, not using the online schedule, it will basically take them to Gina or add family members. So this is the regular login for your current patients. If they click on Gina, then they can click on schedule appointment in here, and it will take them through the same exact flow as previously, as it was previously basically set up. So if a patient, again, already exists on MyChart, then they can definitely just log in and schedule. If they are an existing patient and they don't actually have a MyChart, then you can still send them that link and they can register for MyChart and schedule for an online appointment. So it doesn't matter if they are existing or not. What's the easiest way to block out time for a webinar? Does setting a block prevent patients from scheduling? Yes, Dr. Lu. Basically, all the schedule times that are blocked in here. So if you add a schedule, like a block on the schedule, it will actually block off that time slot from the availabilities on the online schedule. So that way you don't have to, if you have a webinar, if you have anything going on, just obviously make sure that you're blocking off the column that that is open for teledentistry. So if you block another column and that column that you have set up for online scheduling is still open, then it will not know obviously that that block is covering all the operators. So just make sure that you're adding that block or that that webinar basically time slot on the column that actually has the online scheduling preset. So that way it hides that availability off of the online schedule. Dr. Butler, is there a way to take out the do it later button? I'm not sure how anyone else feels, but I'd rather not give them the option. Chances are extremely high they don't complete it prior to their appointment. Any other offices experience this, and it can set you behind in the schedule waiting for a patient to fill out their paperwork. Definitely, I mean, I mean, it's been an actually ongoing debate because we actually had it as a mandatory part of the flow during even before teledentistry, during the online scheduling time. And a lot of people felt like there was a bit of a setback for patients. So they're actually kind of, they felt like it was slowing down the process of scheduling the appointment. So they kind of blocked it. They basically dropped it. So they actually didn't actually continue with scheduling the appointment because of that extra step. However, what a lot of offices have actually done is that in that confirmation email that they receive, it actually, they would add, um, it would add a button, or say not button, it will add a paragraph description that would say something like, please make sure if you have not filled out your medical dental history forms, to do so before the appointment, or we're going to have to reschedule your appointment for a later time. So that way the patient understands that it's actually meant to be actually done before the appointment. So that way they don't actually have to worry about, you don't have to worry about waiting for them to do it before their appointment. So it kind of emphasizes for the patient the importance that you actually really do need this. And you can even add a small short line that explains why you need all this information before the appointment. So it could be something like, and on a regular day would have the time to meet face to face, we can have a bit of a discussion. But I mean, due to the way I guess things are being set up, then it would definitely benefit the office or the provider to know a bit more about you prior to your visit or prior to your appointment, basically. So that's what a lot of offices have been doing. So again, just kind of to reiterate to the patient the importance of that document or those forms to be filled out. And it actually is a line that they add into the appointment confirmation, saying that if please make sure that you filled it out if you didn't already, otherwise we're going to have to reschedule your appointment. So, and usually no patients would want to reschedule their appointment if they already have that set up, and they would actually take that extra couple of minutes to fill out those forms. Is there a way to add a specific email to receive the online appointment requests? I would like my doctor to receive these to approve and deny. Currently my charts. Right now they're actually going to go to the admin, but what you can do is you can add multiple admins to my chart. So I'm going to show you this actually. I think it's a great question. If you go into the admin, you go into the kiosk setup, and under the My Chart accounts here, so you just click on add account and actually add the doctor's email under this list. So that way the doctor will receive those requests as well as you. And you obviously just simply, you don't accept them, you actually let the doctor accept them himself. Dr. Liu, when will this webinar be available in the library? I think the support can give you a very quick answer to that. And I think the rest of the questions are still being looked at by the support team. So I'm going to go ahead and go back to the flow. So again, if you go to the schedule, and we go to tomorrow, hopefully this has refreshed, perfect. So you can see that Gina's appointment, the one that we scheduled, is in here. It's for exactly 30 minutes. And there's a small cloud in here that shows that this is an online appointment that has been scheduled basically using the online widget. So this is where they would be showing up. Again, they will show up as an appointment once they are accepted. Otherwise, it will show up as a dark blue, so it will completely be, so I'm just going to extend this so you can see what this looks like. So this is a white background, like regular appointment that you see regularly on your schedules. Before you actually accept an appointment, this completely will be just one block color, which is the dark blue color, that will indicate this is an appointment that has been requested but not yet confirmed. So it takes up kind of like a ghost spot on the schedule until you actually either confirm it or decline it. And if you decline it, obviously it removes it off your appointment card. So moving on from here, actually, I want to show you what the patient will actually go through once they do go ahead and fill in their My Chart. So for example, this is an account that I started earlier for Amy. So Amy has requested as well an online appointment, and she, instead of clicking do it later, she actually clicked on yes, go ahead, and she actually went into to fill in the My Chart information. So she filled in her full name, her address, her contacts. And one of the really nice things, obviously, that you do have the assignment in here. So it does as well emphasize that the patient understands that he's financially responsible for all the charges, whether or not the insurance pays for them. So they have to accept this before moving on, which is a really good statement to ensure that patients are aware that they're going to be responsible of those charges that you can actually send them once again. Either you do it before the appointment or after the appointment. It's really up to the office. Either or would work, and I can show you that in a second. So once they click the finish, oops, I forgot to add a phone number. So finish. And it will take them through to the medical history. So the medical history is, I think you guys are familiar with it. Whoever is not familiar with the medical history and the forms in general on my chart, so they start with the general information. They can fill them out, it's optional. And then you have the actual questions. So does the patient have any allergies? You can say yes to fruits, for example. Move on. Any cardiovascular problems? No. Respiratory diseases? You can say no. Gastrointestinal problems. Moving on, neurological, cancer, surgeries, injuries, and so on, you can say no to. Any kind of other problems regarding the muscular system, skin diseases, let's say genital or urinary system, eyes, and general symptoms. And you can see in here under the general symptoms, we actually added the COVID symptoms. So do you have any of the COVID symptoms? And it has a drop down here. So if they say yes, they have actually a whole list of them from here. So they can say they have fever, dry cough, runny nose, and they can add a note. If they have any viral infections or cold sores, they can actually add it in here, and any swellings as well, they can add them in there. So it really creates a good filter for you so that you are aware beforehand um, if those basically patients coming in have any COVID symptoms. So you know beforehand whether or not it's a good idea to refer them to a specialist or to even suggest an emergency visit to the office with those symptoms basically showing out. So this is one of the things that we've added just literally today in the morning. We released this before the webinar. So this is something that's already available on the medical history forms. So that way the patient, when they're filling out their forms, they'll be able to fill this section as well in there. So then moving ahead, so moods and nerves, no. Are you any of those? I'm just gonna say no to this. Smoker, no. And then any medications and supplements, I'm just gonna say nothing in here and just hit the finish. So I'm almost there, and then I only have the dental form left. And whoever is not familiar with the dental form, so it starts with the general information. So how would you rate your mouth? How often you'd usually go to the office for non-emergency examinations, the cleaning routine, and so on and so forth. And then it starts off with the wheel. So the wheel is basically the 4 dental categories, like all the questions divided into those 4 categories between the gum health, the teeth health, the bite and jaw, and then the smile characteristics. So that way the patient actually has a very extensive questionnaire to answer, especially for new patients. That will be the most perfect form of intake for all this information. So that way when the patient actually comes into your office, you will be fully prepared for the case, because not only do you have the patient's questions yes and no, but as well you'll have a risk associated with every one of those categories. So I'm just going to go very quickly through those so you can see them. It's a very visual based dental history, sorry, and I'm saying this, I know a lot of our existing users already know this and they've seen this so many times, but for anyone who's not an Oryx user, the dental history is divided into image based questions. There is a no image that represents what a healthy gum or tooth would look like versus what the question is actually asking about. So this one is asking is if the patient has any bleeding. They can say yes or no. So if they say yes, they can add an additional note and then you can click next. You can say yes to puffy gums or no to normal. Do you have any shrunken back or gum display? And I'm just gonna go ahead and say no. And again, burning sensation. So there's a couple of even videos or GIFs that play around, that play to indicate what the question is actually asking. So it's a very visual-based questionnaire that allows the patient to quickly go through all of those questions without actually noticing the number of questions that you're actually asking. And as well, it's a very in-depth questionnaire that allows you to tell what kind of patient to expect. So for example, I'm going to say yes to cavities, and I'm going to say 5 to 8 teeth, and let's say, I don't know, and toothache in bottom right side. So do you have any difficulty swallowing food? Pits and crates. Do you have any sensitivity? I'm going to say yes to biting and sweets. Any grooves, notches? Do you have any of those conditions? Toothache, cracked, broken teeth? I'm going to say toothache since that cavity question. Any crazed lines, chipped teeth, fractures? Any missing teeth? Any existing restorations? So for example, I'm going to say I have some amalgams and composites. Do you have any food get caught between your teeth? You can say yes. Any pain when closing and opening your mouth? Jaw pushing back? Difficulty chewing? I'm going to say yes to protein bars. Have your teeth changed, let's say thinner? No crowding, no ortho treatment, and no spacing. Biting habits, grinding teeth, and do you have any headaches or problems sleeping? And then last would be as well, if you have any night guards, if you wear any night guards at all. Do you want to change anything about the appearance? That goes into the smile characteristics as well, so the patient can give you a good idea of what they think about their own smile. So let's say, I don't know, not white enough. Is there any problem with the shape? Say no. And then, have you ever bleached? No. And then, are you uncomfortable or self-conscious with your smile? And then, have you ever been disappointed with the appearance or disappointed with the appearance of previous dental work? You can say yes or no. And that will basically come to an end. And when you say finish, you can check your scores, and the system will generate a risk associated with every one of those categories. So what this will allow you to do is that the patient, first of all, will be able to tell what area that they are mostly going to be, like, they are problematic in, and what is going to be the focus of the provider. And you can see that there's a green indicating low risk, yellow is going to be moderate risk, and then the red is going to be high risk. So not only does the patient have a good idea of what their mouth is like, in reality as well, what this allows you to do is, I'm going to just refresh my page here. What this is going to allow you to do is actually import a patient before their appointment, and you can actually tell what kind of a patient is coming up. So for example, I'm going to go ahead and say, let's say Gina. I'm just going to hit the merge button in here. And you will see that these are the risks that are associated with her dental history. So this is really nice because, again, you can even tell what kind of patient is coming up to your practice just by having those forms filled out. So you can see if they have any medical alerts. So for example, in this case, the patient has a fruit alert, and then you have all those histories that are available. So perio for gum and bone, B biomechanical for tooth structure, F functional for muscle and jaw, and then dentofacial for smile characteristics. So even before the patient comes in, you have all this information. You can go into their dental history and you can view all the questions the patient said yes to. So you have that summary in front of you. You have, again, Dr. Kois's interpretation key that will explain every single one of those questions, both on the medical and the dental history, why it's important. So you actually have all of this before the patient comes in for their appointment. So especially if it is a new patient, then this is great information to have. It will help you triage your patients. It will help you narrow down what the problem is. And obviously, it will help save time. Instead of having to ask all these questions live or actually wait for the patient to fill all those out, then this definitely has to be a a part of the flow for all your patients, so that at least when you're ready for them for their appointment, you already have had the time to go over all this information and can again narrow down what the problem could be and what the issue that the patient might have. So this is part of the flow that we're talking about. Um, Going back to the schedule, just so that we can go over again the appointment that we added for tomorrow. So this is Gina's appointment. You can see here the medical alert and the dental history alert that shows up in red. So even when you're looking at your schedule, you'll be able to tell what kind of patients are coming up, because they're going to be showing up on your schedule card here with that risk associated to the patient. So that way you don't have to worry about trying to figure out who the patient is, what the problem could be, that you actually have a very good idea beforehand. So for all the appointments that are coming up through the teledentistry or for teledentistry, you just double click on the appointment, and based on the ADA basically recommendations, they are accepting, and all the insurance actually are accepting the regular consultation codes. So the 0140, for example, 170, any other consultation code that you have in there, you can actually bill it out. However, you need to make sure that you're actually billing out the teledentistry code in your actual claims as well. So two things to know. First of all, for the states, it's already the teledentistry code has been already implemented into the CDT 2020 from the beginning. So the 9995 and 9997 actually are two codes that are, one is for lifetime or basically live teledentistry, and the second one is for like off time. So like you've collected all the information and you're doing like a phone call just to kind of go over what you've already seen previously. So both codes can be used, and they should be submitted in addition to the consultation code. So based on what the ADA committees have recommended is that the pricing of the 9995 code should be something similar to what the already pre-used code for home calls, like the 9410, for example, code be used. So whatever you usually would charge for the 9410 code, it would probably be something similar to what you'll be charging for the teledentistry, but obviously it's up to you. But the idea is that you have to make sure that you submit that teledentistry code to the insurance in addition to the consultation code. So the teledentistry code is not a standalone code. It has to come in addition to the consultation or the evaluation codes that you would usually regularly check out. There is a full list of what the codes are that insurances are accepting, and we can actually send it out if you want to everyone that's attending the official ADA list from the insurance companies. Each insurance company has a list of which codes they're accepting, how often, if they're, and some actually insurances as well are waiving the limitation of how often you can do an evaluation for the time being. So this is really a really nice step as well. ADA has been trying to get more insurance companies to drop their limitations for the frequency of the evaluation. For Canadian accounts, it depends on the provinces. So British Columbia has finally actually added the teledentistry code into their list. So we're going to be deploying this by the end of this week. So for everyone that's in British Columbia, you'll have that 05201 code very soon. For Alberta and Ontario, it's actually already part of your 2020 codes. So you'll be able to actually check that out. And unlike the states, actually the 05201 code is actually a standalone code for the Canadians, and it's per unit of time. So depending on how much time obviously you're booking out or how much time the patient needed, then you can actually bill it to the insurance by unit of time. So so everyone can be booking again. So for the American accounts and for the American practices, again, the 995 and the 9997 are the two codes that you'll be using. Sorry, six actually. The 995 and 9996 will be the codes, versus the Canadians are actually the 05201 per unit of time. British Columbia will only have the 05201 1 unit, versus Alberta and Ontario, I believe, already have as well the 1 unit, the half unit, and the additional units as part of their 2020 codes already in there. And as well, by the way, for the Canadians, you already have the fees associated with every one of the codes automatically built into the system. So this is at least the province's recommendation for the fees. So that will be already in your systems for, again, everyone except British Columbia. British Columbia will have that code by the end of the week released for them. So, so if you double click on that appointment, you can actually click on one of the codes in here. So one of the very frequent ones that are being used right now is actually the limited eval, or as well the spec exam. So it depends on what you want to charge out. Again, this is just because the power code was added in here. So the 0140, and then you can actually add a special icon. Actually, I'm just going to do it with you so you can see where you can do it from. So if you go into the clinical, you can go to procedure codes. I'm going to go into the diagnostics. I'm going to click on add power code. I'm going to add a code that's, again, my consult, my teledentistry code. I'm going to click on add procedure. Again, for everyone that knows how to do this already, I'm just going to show you very quickly. So now I have a code here. This is a primary code and show and schedule. I'm just going to delete all of those random things that people have added in here. All right, so, and if you do need another code for the spec exam, the 0170, you can definitely add it as an additional as well shortcut in here. So now when you go into the schedule, you double click on that appointment. You do have that, again, limited exam is in here. And then this is the teledentistry code, so you can use it in here, and this will add them into your appointments. So that way, the appointment procedures are going to be automatically added into your appointment card. So you will be able to build those out if you want to, like prior to the appointment. So in this case, what you would do is actually walk them out before the appointment. So you hit the complete all button. You go to collect payment. It will take you into the billing page. You have to add, again, in my case, I didn't have a teledentistry fee yet, so we'll add that straight into the invoice, so don't worry about that. We're going to create an invoice with those procedures. I'm going to click on edit procedures, and I'm going to say, for example, this is $10. Save. And now actually I have a bill for $29.95. If you do have Open Edge integration, then you can click on Share Statement with Patient, and the patient will receive an outstanding balance of $29.95 basically for their upcoming appointment. Or if you do have, again, a third-party online payment option that you want to set up, then you'll probably go into, let's say, Square. You can add the patient in, and you can add the outstanding balance and send them a request through Square if you need to. If you do obviously send it through Square, then make sure that you have to come back into Oryx and add a patient payment of the $295. Otherwise, if you do actually use Open Edge and the patient does the payment on my chart, then it will automatically add the payment into this invoice and it will close it off for you. So you'll get an email saying the patient has submitted a payment online, and that way at least it automatically will update the charts or the accounts for the patient, and you don't have to do it yourself. So I'm just going to double check and make sure that we've gone over most of this. So we went over the medical dental history questions. You've seen what the emails look like. And again, at the end of the submission, it's very nice to have all of this imported. And actually, just one thing before I forget, if you do double click on the appointment and you do decide to complete all procedures prior to the visit to actually collect that payment, make sure that you uncheck the checkout appointment so it doesn't actually turn gray like it did in my case, because the patient is not yet checked out. So just make sure that obviously this is not being checked out prior to the day. But again, if you double click on the appointment, it will show you that those are in green, indicating that those have already been walked out on the system. So that way, again, you can create an invoice, you can send the bill for the patient even before their appointment is actually up. And let me see if there's anything else that I want to mention before we go into the Q&A. No, actually, I think, oh yeah, and just obviously, I mean, it's an obvious point, but obviously this is now an appointment on the schedule, meaning that they will receive reminders as often as you have them set up. So you don't have to worry about actually setting up any kind of reminders for the patient different than what they already would receive. So you can change the settings and the reminder system if you want to have maybe a reminder coming out an hour prior to the appointment. If you want kind of a last minute kind of reminder for the patients, then this is what you would do. And just to kind of wrap up things before we go into the Q&A, a couple of tips and things to kind of think about while you're setting this up. And we've kind of collected a couple of things that we've heard from other offices and from some of the, again, the dental associations around basically that have been really very helpful with all their resources. So one of the things that are really good to know and kind of pre-plan before you start scheduling your online teledentistry is, are you actually planning on doing those basically appointments alone or with someone from the office? So it's one thing just to kind of consider if you need some help with paperwork, if you need someone to be writing down the notes as you're talking to the patient. It's something that is worth really thinking about and seeing if you need another team member on the call with you. And obviously you can send that same link that you're sending to the patients to your team members, so that way someone can actually be listening onto the call from the team and actually typing in some of the notes as they're happening. So that's one thing. The second thing, it is important as well to kind of just think whether or not you want to open this teledentistry feature for your existing patients only, or you want to actually have it available for new patients. And obviously if you want it only for existing patients, then you don't want that link to be public, the online schedule. Or if you do want it to be open for any new patient, then you can put it on any of your social media. Again, you can do a blast email, you can put it on your website, as I did again on my mock website. So where is it? There it is. So on my mock website, I said virtual consultation, book your appointment, and just there's a button that takes you to that online widget. So again, if you don't mind having new patients come in for a consult, then definitely have that on your website. That's a really good one. Another thing that's really important is to make sure that your actual interconnection speed is actually really high and fast enough to support teledentistry, and especially that you're going to be doing a two-way video call. So you do want to make sure that your speed is pretty high. Definitely do a speed check on your in your house or in your office, wherever you're going to be doing those calls. Make sure that you have high-speed internet. Make sure that you have a second plan B. So it's really important to have, let's say, if you have a good package, like a mobile data package on your phone, so that you can hotspot if for whatever reason your internet slows down, the Wi-Fi at home in the office. So it's always, again, keep in mind that you're doing a two-way video call, and your internet speed needs to be able to support that. Another thing to keep in mind as well is which apps you want to use. So it's a good thing to consider that some apps are going to be easier to use from, let's say, by elderly patients versus younger patients. So that way, at least just think about it that way. So for example, Zoom allows you to do a waiting room, and Skype, I think, has an option as well if you set it up that way. Google Meet is a great option, but it will only be available if you have the Google Suite. So meaning that if you have your emails connected through Gmail and not like any kind of like Yahoo or Microsoft or whatever else. So if your emails in the office, so like the business emails, are through Google, then it will allow you to create a Google Meet link. And what we usually use in our actually office for our virtual calls is actually a Zoom link. So what you would do is, I'm going to actually go to a regular tab. So for example, meet.com. So the link that we use is actually meet.google.com, and it will allow you to create a meeting. So that way, so for the meeting not to be, for the link not to change every single time with every meeting, what we usually do in our in actually Oryx, and I think it's a common kind of trick, is to actually have it. I'm just gonna call this Teledentistry. Continue. Um, so basically what we can do in here is actually set up, um, actually I think I have to do it through my calendar though. So you have to set up actually through your calendar an appointment that will extend for, let's say, 2 months going forward, because that way at least you don't have to change the link with every single patient. So you can send one link to your patients, and once a patient actually joins, so they click on join here, and it will actually allow you to either admit or cancel the patient coming in. So that way, every time a patient joins their appointment, you can manually admit them into the meeting. So Google Meet has been working very nicely. It's extremely easy to use, and it actually does not need crazy bandwidth. So it does not need basically very high speed internet. So but they don't have something called a waiting room, so you'll have to manually admit people to the appointment, versus Zoom is actually obviously a bit more tailored for that kind of thing. But and you do have an option for a free version with Zoom. It gives you obviously a bit less limitation, a bit more limitations than obviously a paid account. However, again, even a paid account, I think it's approximately $14, I think, a month, and you can have a monthly subscription, not a yearly one. So that could as well help you set a constant link that will use your personal ID. So it's a serial, like a serial number that will send out to the same link for everyone. And there is a waiting room, and people can come in based on whenever it's actually time for their appointment. So there are a lot of resources online for that, and there's a lot of, like, I think every single like video call application has been releasing a lot of those again, COVID-19 resources, how to set up everything for meetings and for basically medical and dental online virtual appointments. So well, if you would like, we can definitely send you a list of those links that we've compiled over time. So that's something that we've been working on, and we've been kind of keeping a close eye on as we were developing the teledentistry features. So I'm gonna take just a 1-minute break to drink some water, and I'll be back and I'll go over the Q&A together. All right, so some of the questions, again, so everyone that would like to start using the teledentistry feature, we can definitely, I don't know, I guess I'll double check with Dr. Rania and see how we want to do it. We'll either send a blast email with the link for every single person, or I don't know, we'll figure it out. We'll send you somehow a link to your online schedule, and this video will be uploaded by tomorrow, hopefully, so that way you can actually watch it. And if you need any help setting any of this up, definitely our support is already ready for you, and we'll definitely be very, very happy to help you with setting all of this up through, again, the operatories, the confirmation emails, and so on and so forth. So let's see. Dr. Matt is asking, where is the online schedule link that we copy to place? Again, we will definitely send that to everyone that is interested in starting to use teledentistry for their system. someone's asking that they would like to know the codes. I will, again, as part of the email that I'll definitely make sure to send out soon, that will actually, again, will package everything that we have received from either ADA or the CDA and all the resources that we have. And we'll definitely include as well the codes. And again, the ADA has a great PDF that we will send out that actually takes you through a step-by-step kind of process of how to build the insurances correctly, the codes for both the teledentistry and the consultation. So that way, you can actually have a very good idea as well which insurances are covering which one of the procedures and how often are they actually being covered. Dr. Olivieri, to send out an update email to the practices, to the practice, do we send the email to support or do we send it on our own? Dr. Olivieri, can you please elaborate on the question? I'm not 100% sure what do you mean. Dr. Butler, you suggest to send the invoice prior to their appointment. How far in advance? It really depends on how you want it to be set up. Some offices, what they do is actually as soon as they accept the appointment, they actually bill out the patient. So they will receive two emails. One email saying, "Thank you. Here's your basically link for the online schedule," and there's an and even like they actually add as part of the body of that confirmation saying something like, you'll be receiving shortly an invoice for your upcoming appointment. Please make sure to basically take care of it before the day of the appointment. Other offices are doing it the day before. So they kind of do a whole run on the patients are coming up the next day and sending out the invoices. And some other offices are actually doing it as soon as the appointment is done. They have another team member waiting for the appointment to be done. They walk it out like they would just basically at the front desk and send that bill electronically. So it really depends on how often you would like to, how far ahead or soon after you would like to actually bill the patients. And it's just a matter of creating a system that you think would work. Some offices have found no problem at all getting their patients to pay for their online appointments. Some offices have found a bit more trouble with catching up with the patients and making sure that they do pay. So you would know your patients probably better, and you'd know what would work better for your patients. Dr. Oliver, you're asking if, okay, so right now the batch emails, so if you go into your email campaigns, you can prepare that email, that last email, basically content. You can add everything that you want. As soon as it's ready, just let us know and we'll blast it basically from our side. We need to kind of push that trigger to actually send it out to all your patients. So prepare the content, and once you're done, just email support, and support will let the engineers know to actually send it off to all your patients. And again, Dr. Olivieri, how do you change box number 38 on the insurance form to 02 from 11, because we're not in the dental office? Actually, it's a very good question. And it comes from the finance billing configurations. And it is here, exactly. So the default practice services, and you have basically, this is the drop down that you'll be changing. Actually, I am not 100% sure. I think it's maybe its other location would be the best option for this. I'm not 100% sure. I probably need to check with the ADA form and see which one would actually make most sense. But these are basically the official list of options for the claim forms. And Dr. Moss, if we cancel a patient's appointment because they haven't paid or filled out their forms, do they receive a notification? If you've already accepted it and then you canceled it, no, they won't actually receive an email. If you declined it, then basically they just never actually receive a confirmation for their appointment. So I would advise, in the case of cancellation, definitely use the two-way communication. So for example, if Gina never paid and I want to cancel her, my advice would be come in here, cancel her, and then click on the communication activity and either send a text or an email saying that your appointment has been canceled due to blah, 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 basically. So that way, at least you'll be able to have that flexibility of writing anything that you need basically out in this email. And I'm just gonna make sure. Oops. Okay. So I think I had my share screen um, frozen. So again, so the idea is like again, Gina, if you want to cancel her, you just click on cancel here, and you come into the communication activity. You can either click on send text or you can send email, and you can create templates for your emails even as well, and you can type an email, obviously freehand as well, and say that you're canceling for whatever reason you want. So that way, at least, again, you'll have the flexibility of typing in whatever you want in here. Um, will you be updating us on how to change the claim to reflect the service was performed outside the office? Again, yes. So basically, again, for your ADA forms, for the ADA claim form, if you go into the billing configurations, just you have to change the practice service into other location, and to automatically update that checkbox on the ADA form, and obviously electronically as well, to the other location instead of the office being. So this is actually the only way to change that. And again, otherwise, you can definitely just, once you submit the teledentistry code in addition to the consult code, then it will automatically as well accept it as basically a teledentistry appointment. Do you have any other questions? All right. So you're you're most welcome, Dr. Hoja. We've been working really hard to get this out, hopefully smoothly running, so that everyone will be able to utilize this. And again, we do understand it's been a really hard time for everyone, and we definitely want to provide you with basically any tools that we could to help you through this time, and obviously be able to provide for your patients as well some care, at least remotely. So our support again is more than happy to to support you and to answer any questions. Again, the video will be available tomorrow, hopefully on the YouTube link that we've sent out, and we'll send out another update for sure. You're most welcome, everyone, and we're really happy that you guys have have seen the work that we've put into this, and we're more than happy to keep on pushing this further. Any ideas, any enhancements, any extra things that you'd like to optimize this, definitely make sure to send it our way, and we'll definitely be deploying and releasing more and more enhancements and changes to this to actually to actually hopefully make this as perfect, as smooth as possible for everyone, and flexible. So have a great day, everyone, and we'll be talking very soon. And make sure that tomorrow everyone is registered for Sandy Roth's webinar. It's going to be a great one. She's full of energy. She's super amazing, and I think it will be a great webinar to attend for the entire team. She'll definitely pump some energy into everyone. So talk to you tomorrow, everyone, and have a great day again.